Hello guys and welcome back to Nextillo. This is Dr. Vishal. Today we have with us our Faculty of Radiology, Dr. Rajendra Punia sir. He's been mentoring to students since many years and he's been guiding to students in academic settings. Let us hear him out. What is his approach to study radiology?
Hello, Dr. Vishal. Thank you very much for such a warm welcome. And I'm here to teach you students the radiology.
Right.
And my first thing about the radiology is that welcome to the black and white world.
So sir, what is the one word? If I ask you, sir, describe radiology in one word. What is that word?
Actually, describing radiology in one word is a bit difficult. But I would say in one word, then eye would be the thing. The eye. Because the radiologist is an eye for a physician, he's an eye or he or she is an eye for a surgeon, because they look at a patient and they think about the disease. We look at the disease, we diagnose the disease in a CT, MRI, X-ray, in any modality, and then we think about the patient. This is the inverse. They send us a patient and we will look for, okay, this is what the physician and the surgeon is thinking about, and this is what it is. So we are working as an eye for them. We can look inside the patient. They can look outside of the patient and the clinical and the history and other things. We do what the eye can do.
Sir, radiology is always a topper's choice. What is the most happening thing and why it is so fascinating?
Radiologist, the most fascinating part what I had felt about radiology is a bit of a cool lifestyle. About although people do think like that, radiology don't have that sort of emergency, but yeah, it's not true. Radiologists have equal emergency duties, like if a obstetrician or any surgeon is doing any surgery, if it's get any complication, we are the one. And even our extended branch intervention, it's also getting into the emergencies. So sort of, but still it a bit cooler branch. So that's why I think most of the people do choose. And the other thing is a sort of trend as per the human nature. What other are doing, we also follow the same trend. Actually, I had also seen my seniors, which was sort of inspiration for me. And when they had chosen radiology, I have followed them. And at the point of time when I got a good rank, I also gone for the same thing.
So, sir, whenever we talk about a clinical exposure of an undergraduate to radiology is very less in the MBBS years.
Yes.
And negligible in period of internship. How do you see this? Means, what is your advice to the students who want to, see radiology in a first clinical exposure?
Yeah, it's very much true. Even in my MBBS days and even in my internship days, 15 days posting was there in radiology.
And that was optional.
That was also optional, and none of us had chosen that. I don't know why we had done that, but now I think when I think about the past, if even in our final year when we used to go to medicine and in our surgery department, we should have gone with every patient who is going for ultrasound. We should look for that, what they are diagnosing, what they are doing in MRI. We would have a better exposure. And our clinical approach would have developed a little better than what we had developed. Yeah, so that's part I would suggest to the interns and the final year students. Go for it, look for CT, look for MRI. Seniors के पीछे पड़ो, पढ़ाएंगे.
Right. What is your advice to the students who are preparing for competitive exams, and as well as the students who are still undergraduates? They are learning the subject radiology. What is your advice to them, sir?
You are actually learning part like in the MBBS third year or final year, who are going for the postings. I will always advise them to go for the clinical approach. Not go for like, okay, I will study this. Okay, reading part is different. Go for the clinical. Look at a patient, how they are dealing with the patient, how your seniors are dealing with the patient, how they are using the radiologist. Using a radiologist for your diagnosis, using a pathologist report for your diagnosis. That part is important. If we try to focus on that, okay, they have been sent to for the like CBC reports, you should know ki, okay, acha, ye hua hai. They are sent for ultrasound, okay, this is the report. Try to develop this kind of curiosity. If you have that kind of curiosity ki, okay, I'm going for the follow-up. We were thinking ki, okay, patient ko tuberculosis hai. But then try to look for chest x-ray. What kind of findings we are finding in that?
Right.
Go for if patient had undergone any CT scan, go for it. Have a look. Because once you develop this habit now, finally you will be like every patient you will go for all sort of investigation.
Right.
When you will go for all sort of, because finding a diagnosis are steps.
Right.
They are not like jumping on a conclusion.
Understood.
Because every drug you are giving to the patient, everything you are doing with the patient is just on the basis of a final diagnosis.
Right.
And it cannot be done on only one aspect.
True.
So, okay, so go for all the aspects. Your seniors are doing that because the resident doctors, the senior doctors, they are doing that. But being a third year, fourth year, instead of staying out there and like, okay, my topic pad leta. Instead of that, look what they are doing,
Right.
what your seniors are doing.
Right.
They are using a pathologist report, a radiologist report, and their knowledge for the final, a perfect recipe.
Right.
Go for that thing.
Right.
And next thing for the students who are looking for an exam, who are aspirants, don't take radiology as any like multiple short subjects are
Right.
there.
Right.
They do have a thing, okay, this is thing. They do have a completely different aspect. Like every short subject have there, opthal, ENT, but radiology is a mixture. It's like it will always help you to get a better rank.
Right. Sir.
Because it has every aspect. GIT is different. Respi, it will get into Respi, it will get into GIT, it will get into MSK. Every subject will be different. So the most crisp part, which will get you the maximum question, will be covered under radiology.
Right.
Either it's syndromes, either it's signs. So go for it.
Right.
Radiology is not something like, okay, I will complete it. No. Always try to look for the signs, symbols. They will help you even in medicine, even in surgery. Each and every subject it will help.
Right. How your lectures at Nextillo are going to help students?
In my lecture, what I had done is first I had tried to get an approach. Like looking at an X-ray, looking for a sign. What we used to do. What we used to do at that time we were doing our internship and our preparation, what we used to do, we look at an X-ray, this is the diagnosis. No. What I had tried for my students, first give them a brief like for the anatomy part so they can read that part. They can properly interpret an X-ray, not jumping to the conclusion. They will look for how to read an X-ray and then go for the diagnosis. Right. So what happens generally, if like very frequent questions are there like pleural effusion, chest X-ray, pneumothorax, these are kind of questions you can do by your normal jaisa apan karte hain. But what happens when a tough question will be there, then approach will only help. Because in the first aspect you will think like X-ray normal. But when you will go by the approach, you will look each and every part. It will, by the practice, it will save your time. And it will improve your rank. Because when you do such kind of questions, because you know how to read it.
Right.
You are not like कि मैंने ऐसा देखा, this is the sign. No. You know how to read it as a radiologist.
Right.
I have given that kind of approach to my students. I have tried that.
Right.
So best of luck for my students.
Definitely, sir. Thank you so much for your precious advice. I believe that all students are going to get a lot of help from your lectures.
Sure.
Thank you so much, sir, for your time. Thank you.
Thank you.